We are back with Dr. Malik Johnson, a dentist here in Greensboro. We're talking about all things teeth, so make sure you get your questions in by texting them. All right, this person's asking, when does a dental problem become a medical issue?
Hmm, very good. Okay, first thing that comes to mind, let's say you have a tooth that's been bothering you for a while. You've been putting it off. It starts to hurt, then you wake up one morning and you're swollen. So now that's a medical problem. Any swelling, any gross inflammation in the body is not good. And sometimes it's rare, but sometimes that infection, that pocket of bacteria can spread to different parts of your body, most commonly down to the neck, and in some rarest of cases, up to the opposite way towards the brain, which you can imagine would not be good. So if you have a case where you wake up very swollen and something like that, I definitely would consider that a medical problem at that point. I mean, any any pain, I would consider a medical issue.
All right, so but like if like on the weekend or something like that, you have a toothache, you shouldn't go to the ER. You should wait for the dentist. But when should you like maybe go to the ER because of something?
If you're swollen
Uh-huh.
and it's the weekend or you can't see a dentist, definitely go to the ER. Antibiotics, things like that to bring that down. Yeah, don't play around with swellings.
Gotcha. Okay. This person's saying, how long after recovering from COVID should I wait before coming in for my cleaning?
Hmm, Interesting question. I believe guidelines say at least want your fever to be reduced for 24, 48 hours before, even joining the masses of people, right? As a dentist, I honestly would want you to wait at least about 2 weeks. Because in our office, I mean, obviously we're working directly in the mouth. COVID is transmitted through, the mouth and saliva and things here, aerosols. In the dentist, we spraying water, we spraying air, just shooting around. That's
Mm-hmm.
we don't want to be at risk. We don't want, any neighboring assistants or patients to also be at risk. So just give us some time, 2 weeks, make sure you're good.
Okay. This person's saying, what is the most effective toothbrush shape?
Most effective toothbrush shape. Well, I will say that there's two, I guess, shapes that I really like. If you're using a manual toothbrush, I really like the brushes that have the slim bristles. They're normally skinny, rectangular with slim bristles. Those kind of get in between your teeth better. But the electric toothbrushes normally are circular and they oscillate. And so those circular motions are very good because if you look at how your tooth is, something circular is going to hit, all around it, right? So that would be my answer to that.
Okay. This person says, I'm 64 years old and I still have silver fillings in my mouth. Is this a health concern?
It is not a health concern. There's a lot of stuff going around about the silver fillings releasing mercury and poisoning you and things like that, but that is a very, 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 very low amount of trace mercury in those silver fillings. It's not going to cause systemic issues. Silver fillings are actually very strong and very durable. So a lot of wiser people, who have been around a little bit longer, have those silver fillings, and a lot of them are still intact. Um, People come in sometimes and they want me to swap the silver fillings out for white. If it's a cosmetic concern, that's fine. But sometimes I'll encourage people to like, hey, this tooth has been getting along for this long, 60 some years. Let's just leave it alone.
Right.
Okay. So don't be too worried about your silver fillings. They're actually doing well.
Okay. This person's asking, is carbonated water just as effective as plain water? Because we were talking about swishing and things of that nature.
All right, cool. So, okay, carbonated water is still, water. So it still has hydration qualities. Um, it's still going to do good things. However, it is carbonated, which typically has something to do with which typically will lower that pH in your mouth. So what we were talking about earlier, acid breeding cavities. So that carbonation is going to kind of help create an acidic environment. But it's still with water, so it's minimal compared to like a soda or a juice, right? And
Mm-hmm.
obviously, if you're drinking a carbonated water that's flavored or sugared, has sugar in it, then that's not going to be um, any as effective as just regular water.
Plain old water.
If you like your water with a little taste and you have to have carbonated water to drink water, please go drink that carbonated.
Just don't swish with it. Okay.